Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing, the notes on nursing, and the NCLEX. Today's focus is going to be on this sticky note, dopamine. Now, previously I talked about dobutamine in my previous lecture, and these are often confused. Dobutamine is strictly beta 1 heart, and when we're talking about that, it's mainly only affecting beta 1. So that's the big thing. I talked about in that previous lecture, so please see that lecture on dobutamine, where I talk about when that's giving and cardiogenic shock and also septic shock. More importantly, mostly cardiogenic shock. But we're going to talk about dopamine. All right, so let's get into dopamine. Now, dopamine, well, excuse me. Now, dopamine is a little bit different because dopamine is a fantastic medication because it does several properties. So I have here that says, it drops a beta beat, then squeeze the mean. And what I mean by that is on the lower levels, less than 10 micrograms, it's mainly beta 1. So it works on that beta 1 heart. But it has a little bit of alpha. And what alpha is, in the previous lecture, I talk about alpha. And I say alpha, you flip upside down, looks like a V, and V is vasopressors. So it tends to squeeze. And what I mean by squeeze is that in the body, your alpha receptors, I'm drawing Gumby, it's okay, your alpha are away from the heart. Okay? So when you squeeze these alphas, it pulls up, vasoconstricts all the blood to the heart. So alpha is very good for like septic patients, where you fill them up with fluid first and then you squeeze to support the body. Okay. All right, so dopamine, like I said, so 0 to 5 is mainly beta. So the interesting thing about this is that it needs to be given in a triple lumen. If it is ever given peripherally, just like dobutamine, you worry about extravacation, which that means is that if it infiltrates, the tissue will become damaged. So you would need an antidote like Regitine. And that's acute. So that's why we don't put it peripherally. We like to give it in a triple lumen. 0 to 5 micrograms per kilogram, not important, but 0 to 5 is beta 1. So it's going to affect the heart. So the minute you put it up, a lot of times, especially in the emergency room, when they put it up, the heart rate really skyrockets, 120s, 140s. And depending on what the underlying cause is, so if you think about it, in cardiogenic shock, different stages, we kind of worry about that. But it's also given during cardiac shock. But it's a little bit more concerning than if a person has, like, for example, an MI. You'd be worried about giving beta because you don't want the heart to be pumping more than it should be. All right, so 0 to 5 is beta. 6 to 10 is beta and alpha. So you start to get a little bit more squeeze in the body and while still pumping the heart. And that's important because when you're pumping the heart, like in a patient with septic, so this makes a perfect septic medication. So in sepsis, we know that the volume is low because of extreme vasodilation, because of the presence of lactic acid. So if they have a positive lactic acid, you're going to have vasodilation. Well, so the rule of thumb is you fill the pump. So you fill them up with fluid before you squeeze. Okay? So that's why with a septic patient, we give them 4 to 6 liters. Well, follow agency policy. Then we gently squeeze. And how do we do that? Well, with this medication, we can start off with beta and be pumping that heart, supporting it. And then we can start to raise the beta. And in turn, we're going to have an increase of blood pressure. We have an increase of cardiac output and increase of mean. As we start to raise this blood pressure, once we get greater than 10 micrograms per kilogram per minute, it is only alpha. Only, alpha. And what I mean by that, it's only working as a vasopressor now. And that's an important concept to know. It's an advanced concept, but it's an important concept nonetheless. And so it kind of acts like a neosynephrine. A neosynephrine, like neo, is strictly alpha, which means it only squeezes. It doesn't work on the heart. It's not like level fed. Level fed will work alpha and beta, but dopamine starts off beta, becomes beta and alpha, and then only becomes alpha when it's greater than 10. And you can go up to 20 micrograms with this. And that's about it with this medication. So when do we hold for it? Well, if they're on MAO inhibitors, we hold this medication. Also, sensitivity to sulfites, like with dobutamine. We give through a central line. We definitely put them on a monitor. And then we also would want hemodynamics, like a CVP, a PAWP, cardiac output if we have it, and we'll be monitoring the mean arterial pressure. And their ejection fraction, if they're on dopamine, most likely might be less than 60%. And we want it greater than 60%. 60% equals perfusion. So a normal CVP is 4 to 8. 8 means too much fluid. 4 means not enough fluid, means they're dry. So we want to correct the underlying cause first before we give any kind of vasopressor, like dopamine, dobutamine, level fed, neo. Wedge pressure, add these two together, you have 12, and then 8 to 12. So less than is low, greater than is too much fluid. Cardiac output, so is 4 to 8. Mean arterial pressure is 3 dentists, right? So 3 DDS, diastolic times 2 divided by 3. It needs to be 60 to 65. Okay, some other things we need to know. Worry about infiltration, and don't confuse with dobutamine. Okay, let's do our AWELS. AWELS is a method that I use in order to evaluate a medication to see if my content is covered. Okay, first thing is it acute or chronic? It's acute, so I see it in a question. It's definitely an acute question. How does it work? Well, it works three different levels. It works on beta, on low levels. It works in the heart. Then it's beta and alpha. And then greater than 10, it's strictly alpha, which means it only squeezes. Peripheral. That's supposed to be peripheral. When do we hold it? MAO inhibitors. If the blood pressure is too increased, because it's going to cause it to go increase more. We need a central line for it, and we'd want hemodynamics. What's the assessment? Well, we assess the site because of infiltration. If any redness or anything above the site, always stop this medication. Labs, mainly hemodynamics. Any eating? No. Stands out. Well, it can be confused with dopamine. The main difference is that it has 3 different levels. That's different than dobutamine, and this works on beta and alpha, where dobutamine only works on beta. It can be infiltrated, and that's acute, and you need to call the doctor. So that's definitely another thing that stands out for the S. Well, that's about it. My name is Nursing Kamp. I can be followed on nursingkamp.com, found on Instagram, Nursing Kamp, Facebook, Nursing Kamp, Pinterest, Nursing Kamp, where you can download this study sheet free of charge, and then on nursingkamp.com. All right, nurses, that's it. Have a good night, and we'll talk next time and nurse on.